The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
More than 135,000 people in this province have tested positive for COVID-19. And while most ultimately recovered, for many, it's not so simple. Tonight, we're examining the experience of the so-called long haulers and the lasting, sometimes grueling effects of COVID-19. Then, the Federal Minister of Indigenous Services explains why his government missed their mark on ending boil water advisories in this country. Also, from our Ontario hubs, how families are handling tough choices to get help from their children with complex care needs. I'm Jan Jaganathan. It's Friday, December 11th, and that's all ahead on the agenda. As COVID-19 case counts have risen to record levels during the second wave, you might think that those infected during the first wave have put it behind them. But that's far from true for everyone. Even some who experienced relatively mild cases have found themselves struggling for months with puzzling, sometimes debilitating long-term symptoms. With us now on those who have been dubbed long haulers in Indianapolis, Indiana, Dr. Natalie Lambert, Associate Research Professor at the Indiana University School of Medicine. In Ottawa, Ontario, Chandra Pasma, a long COVID patient, advocate, and parent. In the downtown core of the provincial capital at Toronto Western Hospital, Dr. Angela Chung, professor of medicine at the University of Toronto, senior scientist at the University Health Network, and co-lead of the CanCove study into the effects of COVID-19 on recovering patients. And finally, in North York, Dr. Iris Gorfinkel, a family physician and researcher at Prime Health Clinical Research. Welcome everyone to the show.
Thank you.
So just over 5 months ago, Chandra, you and 51 other long haulers sent an open letter to Canada's chief public health officers asking for research and support in this field. So to help set up our discussion, here's a look at some of what was said. We've been trying for months to deal with symptoms that are often severe and scary, and that significantly affects quality of life. Some of us continue to visit the emergency department with heart issues, neurological issues, or shortness of breath months after the onset of symptoms. Some of us are formerly fit athletes who are still unable to walk around the block or upstairs due to stabbing chest pain and shortness of breath, months after initial illness. So Chandra, we'll start off with you. I think it's an appropriate question to ask. How are you feeling today?
Today is a pretty good day. Yesterday I had quite a few symptoms again, but today I'm feeling much better. But I'm still nearly 9 months after getting sick, not still symptom-free.
So walk us through that. What was the recovery, the COVID recovery process been like for you and your family?
So my whole family of 5 has been sick. That's my 7-year-old twins, my 10-year-old daughter, and my husband. And we all had slightly different patterns that are kind of reflective of the different experiences long haulers are having. My 7-year-old twins experienced the same symptoms for months. They had severe chest pain and coughing, in the case of my daughter for 6 months before it finally cleared up. My older daughter and my husband, they seemed to have milder cases, but their symptoms kept coming back. So they would have 7 to 10 days where they would seem to be symptom-free, and we would think they were recovered, and suddenly they would have symptoms back. And it could be totally new and different symptoms. So, headaches, rashes, tingling in the hands and feet, but just not ever back to their baseline for a good 6 months. And in my case, I kept developing new symptoms. So I would have symptoms for 7, maybe 14 days, and they would clear up, and I would think I was over it, and suddenly I would have something new. So I had pleurisy, or severe inflammation of the lining of my chest. I had really bad skin rashes and blisters. I had headaches, brain fog, dizziness, heart rate issues. Basically, my whole body was affected at one point or another.
Now, I'm curious, you penned that letter to health officials in June. Do you feel that any of those concerns were answered?
No, the response that we got was really a brush off that if you have medical concerns, you should speak to your doctor. They did refer us to the CanCove network. So we have been talking to those researchers there, but they don't have the ability to direct research. So we're still in the same position of trying to raise awareness among researchers that this is going on. there is more awareness among doctors, but everybody's experience really varies. It seems like doctors are also getting their information from the media. So some people are lucky that their doctor has read the reports and are aware that this is going on, but there are still people who are being dismissed and told that their symptoms are just anxiety and depression and can't possibly be related to COVID.
Well, let's open it up to the doctors and researchers on this panel. What has been the biggest obstacle in getting to the bottom of exactly what's going on with COVID long haulers? I'll start with Dr. Chung.
COVID is quite new. We started having COVID in January in Canada, and I would say that we are just up to about 9 months seeing patients with COVID. And it is really a full spectrum. Some patients do get over it in 2 or 3 days, and there are others who still have residual symptoms 9 months out. And what Chandra is talking about is quite common, that the symptoms waxes and wanes, and often they'll be told that their tests are normal, but these symptoms are quite real. And I think the more that we actually see and understand, and also trying to do testing to really understand the underpinnings of why that's happening is important.
Dr. Lambert, what do you think is one of the biggest obstacles?
I would say it's a couple of things when it comes to trying to do research to really understand what COVID is and all of its health impacts. One of the first ones is that the majority of patients are not hospitalized. So what that means is that we don't have very many medical records on those people. So we have to reach out to COVID survivors who are not hospitalized to collect that data, analyze it to understand their experiences. Another really tricky component is that COVID can look very different for every single person who catches it. So some people, have these short-term symptoms, seem to get better in a week or two, but then later on will have heart problems. Other people are very sick from the beginning or even having neurological impacts. So it's a wide range of symptoms. We've actually found that it's over 100 possible symptoms that people have reported from COVID.
We'll get into that a little later now. Dr. Gorfinkel, you're a primary care physician. What would you say is one of the biggest obstacles with trying to understand COVID long haulers?
First, I want to say thank you to Chandra for the work she's doing. I think it's extremely important, and it helps to drive research. Secondly, what's been the key issue? I think as a primary care doctor, my coming to terms with helplessness over the uncertainty that this diagnosis brings. So we don't know exactly what is causing it. We know that it's a multi-system disease, but we don't know its underpinning. How is it going to go? Well, 45% of people are asymptomatic. An estimated 5 to 10% of individuals suffer as Chandra is suffering, with long haul symptoms that can be completely unpredictable. So getting comfortable in that space of uncertainty is not easy. We don't know the pathogenesis, why it's happening. We know that it can involve many systems, but we also don't know the prognosis. And those are serious problems.
I want to follow up on that, Dr. Gorfinkel. Your sister is also a long hauler. What's it been like for her in that experience?
She's also a family doctor, and she was diagnosed in early April. So Illinois, where she lives, was one of the hardest hit states at the time. And like many long haulers, actually, tests were not widely available there. And it started out with actually very mild type of symptoms. She was dismissive of the initial chills she had. And note, she had gone to work for the first 2 days in a healthcare facility. Testing was not widely available. She ultimately was tested positive. That said, by day 3, she was struck with extreme fatigue, was off for the next 2 weeks. Day 4, she felt a burning sensation in her nose and then lost her sense of smell. We're now 9 months out. She only has about 25% of her sense of smell back. I think she's fairly representative of what many of these patients experience. Her taste is also gone and highly affected by that. She estimates that she has about 25% of that back. But it's representative of what these patients are experiencing, and it's severely problematic. And for me as a healthcare worker, It's scary because she had minimal symptoms for the first 2 days, actually spread the disease probably during those 2 days to patients she had seen. Mind you, at the time, they were masking and using protection, but even with that, how can we be certain? And the testing remains a bit of an obstacle.
Well, I'm curious on that. As a family doctor, what's the course of action? You have a patient that comes in months after they've tested with COVID. They show those symptoms. What are you doing?
First thing I always try to do is get their medical history and validate their concerns. One of their worst fears is to be gaslighted. In other words, to be told, you know what, your symptoms are in your head. And many of them have been told just that. We know that it is impossible not to experience anxiety. I think that's a given that most of these patients are going to have anxiety, but it's secondary to their symptoms. Because if a person experiences profound fatigue and yet cannot sleep, if a person tries to exercise, which is their usual go-to, and yet experiences profound fatigue following that, they might just get a little anxious. And never mind the chest pain and the shortness of breath. What do we do with these symptoms? I'll share with you, we wind up referring them to multiple services: respirology, hematology, neurology, ENT, cardiology. And that's a huge burden. And I'm not just talking about on the system. I'm talking about for the patients themselves. And what do these doctors do? They wind up following the patients because they themselves do not know the pathogenesis and the prognosis of how this is going to turn out.
All right, I want to turn to some of the studies that have been done and are in progress when it comes to COVID long haulers. Dr. Chung, you're co-leading a Canadian study on COVID patients' recovery. What have you been able to learn about long haulers so far?
So yes, we're running a study that is supported by Canadian Institutes of Health Research and actually the COVID-19 Immunity Task Force as well. It's in the early days in terms of what we can tell people in terms of what we have learned. But I will share with you what we have learned in terms of we have more than 400 participants in the study. And I would say that about 165 of these actually don't have a positive test, and we're trying to figure out their serology status. We are looking at, very detailed history, as you heard. It's really important to try to understand the whole history of what happens to the patient. And we are also looking over what has been done in terms of testing as well. And you also heard that because often some of the tests are normal, so the patients are kind of brushed off. It is important to know that this is a new science, a new disease. Yes, we have had previous sort of post-viral syndromes and other things. And so what we have learned is that some of these residual symptoms or long-term symptoms remind me of syndromes like POTS, postural orthostatic tachycardia, reminds me of deconditioning, and reminds me of myogenic encephalomyelitis, or CFS, chronic fatigue syndrome. So it is a bit of a spectrum. And I like to use the analogy of because it's still new, and there are, yes, we're 9 months into this, but we are just beginning to learn and understand. And so I like to use the analogy of 10 blind men feeling an elephant. So one person will say, this is feeling the trunk, say, this is like a wall. Someone will be feeling the tail and say it's like a rope. And someone can be feeling the trunk and it's different, may be different to the other person. So it's really important that we all come together and discuss it and learn from it as well, both patients and healthcare providers and researchers. And actually, over the last 2 days, there was a conference called the Long COVID Forum. It was coordinated by CIHR, the Canadian Institutes of Health Research, as well as the UK ICERIC and also GLOPIT-R. And this forum was really bringing the various aspects, the researchers, the policymakers, the WHO, NIH, and other parties to the table to try to identify the gaps. And one of the gaps that was identified is actually studies looking at kids, like Chandra's kids, who have symptoms 6 months later. So it is still fairly early on.
Very interesting. I want to actually talk to Dr. Lambert, a very different, less traditional research approach to COVID-19. Can you explain your approach?
Absolutely. So my approach is to actually go online and find patients where they are talking to each other about their experiences with the disease. I was doing this with breast cancer, and when COVID hit, I went online, examined a lot of the patient narratives, and it was clear that what patients were reporting they were going through was very different from what you could see on official sources of information, even the CDC's website. So what I've started to do is I've collaborated with a nonprofit called Survivor Corps and have gone to their Facebook group and used the Facebook group of COVID survivors. Right now they have over 120,000 members in that group, and send out survey recruitments in that Facebook group. And I'm also collecting all of the posts and comments and using a technique called natural language processing to find common topics of conversation around different aspects of the disease. So my goal is to look at a very large scale what patients are talking about, what they've gone through with COVID, and to try to find some patterns or commonalities that could help inform medical therapies and future research on the disease.
I'm curious, is there, it seems like there's abundant of information in terms of patients, COVID long haulers who are showing and sharing their symptoms. I guess is there still a stigma with people with COVID who probably don't want to share their symptoms and probably don't want to tell, the rest of the world that they do have COVID? Is that what you're finding at all, or absolutely not?
There's actually quite a bit of stigma, and it can happen in a lot of different places. One of the most common places patients report it is actually in the workplace. So there are people who are, working in a variety of different industries, different types of careers, and they're afraid to let their employer know that they're having these long-term COVID symptoms, or that they're having brain fog and memory problems because they think that they could lose their job potentially. There's stigma sharing this information with friends or even family members who may not understand what the infectious period is of the disease, so they're afraid if someone is still having these symptoms long-term that they could still be contagious. So there's just a lot of stigma everywhere, and even just the idea that, that this is an unknown disease, and that to admit that you're having these long-term problems, that they're not fully recognized by everyone. So they're concerned about gaslighting from a lot of different areas in their life too.
I want to dig a little deeper into some of your data. We have a chart that shows 10 of the 50 most common long hauler symptoms that your data helped identify. So at the top, we can see fatigue is the most common, with more than 1,500 people who are participating in your survey checking that off, followed by muscle or body aches, shortness of breath or difficulty breathing, then difficulty concentrating or focusing, inability to exercise or be active, headache, difficulty sleeping, followed, rounding out the bottom half there, anxiety, memory problems, and then at number 10, dizziness. Now, I'm surprised there's one that I'm not seeing that surprises me, but what surprised you most when you first saw all those symptoms?
What surprised me the most was definitely all the symptoms that were indicators of neurological impacts. So this really goes against the narrative that COVID-19 is a flu. What we're seeing is that these long-term impacts with things like people having trouble remembering how they used to do things, even things like how to operate a dishwasher. Sometimes it's so extreme that people can't remember how to hold a cup of coffee is something that's been reported. So these neurological impacts, but also the fact that by having this open-ended research with patients, just asking about their experiences, we've identified a new symptom, which is inability to exercise. And COVID survivors find that to be very different from just fatigue. So some people do not have fatigue, but they still find that they can't exercise. So really what's impressed me a lot is that when you talk to patients and you ask them what they've gone through, you learn a lot about a disease, particularly a new one like COVID.
Chandra, similar to the Survivor Corps group, there's a COVID Long Haulers Canada Facebook group that you've been active on. Tell me about what you've learned about being part of that community.
Yeah, I'm actually part of a number of different COVID survivor forums, and they've been a very important source of information and moral support. So I have had a number of doctors who have run a lot of tests. No doctor has recommended any therapy or treatment for me, but I have learned things on those forums that I've tried that have helped. There's a lot of information shared about employment and income security, for instance, because we have a big gap in our social safety net in Canada for long haulers. So there's information being shared on that, which is really helpful. And then just the moral support, back in April, when I was still experiencing symptoms after 4 weeks and everybody said it was a 2-week disease, I thought I was going crazy and it was just my family who couldn't recover. And it was just an immense sense of relief to join one of these forums and discover that there were hundreds of thousands of people around the world in exactly the same boat as me. And we're still finding people now who got sick back in March or April who are joining these forums now because they just found out. And that's always the same immense sense of relief that they start out with, just saying, I finally realize I'm not alone.
I'm curious, we were talking about gaslighting. Some patients have expressed they felt their doctors have, dismissed their concerns as anxiety, depression. Is that something you experienced, and what were kind of those initial appointments when you were seeing your doctors like?
So I called our doctor at 2 weeks and talked her through everybody's symptoms, and she agreed that we were probable COVID cases. But when I called her back at 6 weeks and said we were all still having those symptoms, she said they couldn't possibly be COVID anymore because COVID didn't last that long. So it was 3 months before I dared to call back again and say, we're still having these symptoms and now we need to escalate for more medical care. So that was, the initial hurdle that I faced in getting medical care. Since then, my doctors have been less dismissive, but they just don't know what to do. And when I raised the issue of some of the theories and possible causes of COVID symptoms with one of my doctors, he said, I'm a doctor, not a researcher. I'm not going to look into those.
Dr. Gorfinkel, I'm curious to ask, I don't want to put you on the spot here, but as a primary care doctor, have you had patients that you probably thought, you may have dismissed in the past?
I've been guilty of everything you can name, probably when it comes to dismissing patients at some point or another. And I love Chandra's story because I think not only is it representative, but it also points out in this realm of the unknown, when we walk in this area of somewhat of helplessness, the validation is extremely important. And the validation from the family doctor and from specialists who see the patient makes a tremendous difference. In many societies, you cannot call yourself a healer unless you yourself have suffered the problem. And therein lies the beauty of support groups. The fact that they're online and socially distanced is a wonderful thing, but what I find extremely concerning is that 1 in 5 Canadians has no access to a cell phone. They have no computer. So this is something that we cannot use for absolutely everybody. But I do appreciate the fact that this online support mechanism is in place. It makes a tremendous difference to those patients who are going through it. It not only validates the experience, but it can also give the voice of wisdom of a person who has been through that experience. Having said that, it is also potentially treacherous. And why do I use the word treacherous? Because how do you know that that person actually had the disease? That's a serious problem. How do you know that that person is giving medical advice that actually makes sense or does not? So it is not a substitute for getting good care and for understanding and objective testing. So the testing plays a role, follow-up plays a role, and also paying attention to the psychological aspects of this disease, which should not be ignored. I think a good approach to the long hauler is a psychosocial approach. In other words, address the biology 100% with the specialist referrals, but the psychological part is tremendous. One study suggests that up to 50% of patients experience anxiety. They can experience depression with it, and that has to be understood and treated, and not necessarily with a drug-based approach, but with counseling that helps them understand and navigate that space of potential helplessness that the long hauler symptoms can give.
I want to follow up on that with Dr. Chung. Based on everything that you've been learning about long haulers, what advice would you have for primary care doctors?
I totally agree with Dr. Gorfinkel that you need to validate, and I think that's the first thing. It's a learning process. We all are learning at the same time. And I think it is also very important for patients to be seen and participate in studies like ours, where they are donating a little bit of blood so that we can do more testing. And most of these are research tests, and they are not really available to your usual family physician. And because we work in a group across the country of more than 100 investigators, clinicians from different specialties, scientists and researchers, we do come together to try to find answers to these questions. So, for example, our group here in Toronto is trying to work with our rehab colleagues who are interested in COVID to see if we can actually establish a rehabilitation program. And trying to work out what components of that program. Do we need a psychological piece? Do we need trying to put together something that can help people recover faster? One thing that I can share with family physicians is that I see from patients from the clinical side, patients that I'm seeing seem to have autonomic dysregulation. What does that mean? That means that usually when you do something, for example, if you run, your heart rate will go up. If you get angry, your blood pressure will go up. That's normal, but it comes down. And with patients with this, with the COVID long symptoms, something that we see is that the reactions are exaggerated. And it can take a while to sort of come down. So say, for example, the sensation of shortness of breath. It's not unusual that if you're running, you feel a little bit short of breath. But for some of the patients, it's walking one block and they feel short of breath and they can't go back to their marathon running. Those are some of the things that I would sort of share with my family physician colleagues.
Dr. Lambert, in a short period of time, there seems to be a lot of information already on long haulers, with still more to be done. But I'm sure there are some people out there who are probably thinking, this is just like the 2-week flu. What do you say to those people who think, this is just, a 2-week little thing and I'll get over it?
Well, it's easy for me to confidently say that it's definitely not a 2-week flu based on the research that I'm doing. I just did a survey with over 5,600 COVID survivors, and for many of them, their symptoms actually lasted for many months and are ongoing. So that's something that I can say based on what I've seen, but I think the most convincing thing would be to suggest that someone find one of these online COVID support groups, so like Survivor Corps on Facebook, and read other people's stories. So when you hear stories from actual individuals explaining how these long-term symptoms have impacted their health and their families and their ability to just live their normal lives, that's very convincing. So if you're not sure based on the news or the research, go online and listen to people's stories.
Now, Dr. Lambert, I want to follow up with you. The Atlantic published a story on long haulers in August in which the author, Ed Young, wrote, "No matter the exact diagnosis, the COVID-19 pandemic will almost certainly create a substantial wave of chronically disabled people." Are we on the edge of a significant public health issue with COVID long haulers?
I certainly believe so. I think it's, we're in the stage clearly where we're trying to understand the disease. But what we can see is that these symptoms are lasting long term. For some people, some problems that arise, like different types of heart problems, some can resolve on their own, but for many people, it's not. So we're at a stage where we're trying to understand, is the damage that's been done to people's bodies, is it something that we can heal over time, or is it permanent? We don't know yet. And it's going to take a long time to get these answers and to develop therapies that are very effective. So I think that we need to be prepared to help people in the very long term.
Dr. Gorfinkel, we hear a lot about the capacity of hospitals when we talk about ICUs, ventilators in relation to COVID cases. But how has the influx of COVID-19 long haulers impacted the primary care system?
Let's just do the math on this for just a second. Never mind Iris Gorfinkel's personal experience, because that's obviously a biased selection. But consider for a moment that as we approach some 450,000 Canadians infected, do the math. If 10% of those, just 10%, have long-haul symptoms, which is the current estimate, we have, boom, 45,000 patients right off the bat that we're dealing with in primary care. These are not patients that land up on the hospitalization list, the ICU list, or the death list. These are patients who are considered just chronically suffering from the disease. Where do they land? They land in the primary care doctor's office. Where else do they land? In all the specialists' office. And guess what? We're all following them for a long time to come. So will this impact primary care? I think we're predicting the past. Absolutely, it's impacting primary care. Every conversation I have currently with every single patient begins not with the open question, how are you, which was yesteryear's question. It now opens with the question, how are you managing?
We have a couple more minutes. I want to ask a very important question in terms of what's one key takeaway you want people to know when it comes to long COVID sufferers and the road ahead? I'll start with Chandra.
Well, first I want to follow up on something Dr. Gorfinkel said, which is about the incidence of long COVID. First of all, we know that there's a significant proportion of Canadians who have been sick but never got tested or diagnosed. So the official infection rate in Ontario is just under 1%, but the Ontario Health Study just released its preliminary findings, and they found that just under 4% of respondents said that they suspected they had COVID but had never received a diagnosis. So we're talking about 4 times as many people as the actual infection rate. And then 10% of people having persistent symptoms is actually the low end. There are some studies that suggest it's as high as 50 or 60%, because a lot depends on whether you ask people only about specific symptoms or whether you ask them if they have fully recovered and returned to their baseline health. So I think one thing we need to do is not assume we know the incidence of long COVID in Canada, but actually count it. We need to start by surveying the population and finding out who has had COVID or COVID-like symptoms and who has had an experience of prolonged recovery. And we need to go back to the health records of people who were diagnosed early in the pandemic and actually ask them, have you returned to your baseline health? So I think that's the number one thing that I want to see. But number two is that we need to do a much better job of providing support for people who have experienced these ongoing symptoms, both in the front of research and medical care, but also income and employment supports, because there's a lot of people who haven't been able to return to work or haven't been able to return to work in the same way they were working before. And it's going to be a significant problem, especially if we don't help them to fully recover now. As Dr. Lambert said, we're facing the prospect of a significant number of people who are permanently disabled and who are therefore going to be on disability benefits for the rest of their lives if we don't step in and do something now.
I think that's a perfect way to wrap it up. Unfortunately, that's all the time we have. I want to thank you all for joining us today and sharing your personal stories and your research with us. Of course, the story we will continue to follow. Thank you again for joining us tonight.
Many
Great,
thanks.
Thank you.
Thank you.
Thank you.
Mm-hmm.
Last week, the federal government announced it would be unable to meet its promise of lifting all the boil water advisories in Canada by March of 2021. It fell to the Minister of Indigenous Services, Marc Miller, to break that news that no one wanted to hear. He is the Liberal Member of Parliament for the riding of Ville-Marie, le Sud-Ouest, Île-des-Sœurs. And he joins us now from the House of Commons in the nation's capital. Minister, we're grateful you spared some time for us. How are you managing during this pandemic?
Oh, good, Steve. You know, trying to keep up. A lot of work to do fighting the second wave.
Undoubtedly. Let us just, by way of background, put a bit of a fact file up here just so people understand how you got to where you got to. And Sheldon, if you would, here comes the graphic here. Between 2015 and 2020, 97 long-term drinking water advisories were in fact lifted across Canada by the federal government. 59 remain, and those are in 41 communities. The original commitment by the feds was to lift all drinking water advisories in First Nations communities by March 2021. That, of course, is now not going to happen. In the fall economic statement, the feds announced $1.5 billion would be invested to ensure clean drinking water for Indigenous peoples. And since 2016, the feds have made more than $2 billion in commitments to First Nations to build and repair water and wastewater infrastructure. And I guess let's just start here. What was the so-called straw that broke the camel's back where you had that aha moment when you realized we're not going to get this done?
Well, look, first, thanks, Steve, for taking the time to speak about this exceedingly important issue to all Canadians, particularly Indigenous peoples that have been entirely underserved by in an area of critical water infrastructure over decades. But you spoke about the straw that broke the camel's back, and it's a bit of a simplification for the greater challenge of having essentially lost, in some cases, an entire construction season, limited in some cases in remote and northern communities by the impact of COVID as communities shut down to protect their people and to preserve their health, which is something that we absolutely must respect. That is one of the greater challenges we faced over the course of 6 months. But I certainly didn't want to be in a position of standing up and talking to Canadians and saying this is the case when we hadn't seen and charted the course of what COVID may do. And now, while we're in the midst of a second wave and communities are rightfully shutting down, we see that course that is being charted for us. And we took stock of that, and I went back to the Prime Minister and the Minister of Finance to work for a number of funds that would ensure that we would work with communities throughout what is still very in an unpredictable path of COVID, but also a long-term investment. And I think that's what's worth speaking a little longer about in ensuring that we are with communities every step of the way past this, what we've categorized, I guess, as an Ottawa-imposed deadline of spring 2021. For something that really is a question of long-term asset management of critical infrastructure in communities, which is water. And I recognize that there are a number of communities that are left. We could knock another one off based on an announcement yesterday, but there are still, as you said, about 41 communities that are left to lift.
But just so I'm clear on this,
quietly optimistic, but we're making the investments that are needed to be made.
I understand. Just so I'm clear, had it not been for COVID-19 then, are you saying the commitment would have been fulfilled?
Steve, it's very, very difficult to dissociate the two. And I say this because there are a multiplicity of challenges, one of which is COVID. We knew that it was an aggressive timeline going into the year as I was working with my teams, and it really becomes a community by community analysis in seeing what needs to be done to lift each water advisory. There were certainly challenges. There were certain, for example, interim solutions that are being proposed as we work with communities that communities in some cases have rejected, compounded as by COVID, seeing what the long-term plan is for their communities. And we've committed to them to a more longer-term solution, for example, building a new plant, building out some of the infrastructure that is connected to water. And these are commitments that communities rightfully ask of the federal government, and I think it's something that we need to recognize and fund. The commitment itself of $1.5 billion recognizes that there needs to be real investments in fighting COVID, but also working towards long-term solutions, including a recurring generalization that makes sense, which is funding 100% of operations and management of these facilities, which in some cases are state-of-the-art, and people working in them are the pride of their community and can easily be poached by another community that is often non-Indigenous that will pay them more. So really a spectrum of continuity that we were investing in was being demanded of us from Indigenous communities and wasn't necessarily following in the strict categories of, I guess, quote unquote, lifting a long-term water advisory, which I would remind your listeners is something that communities do and the federal government doesn't do.
No, I take your point on that, but the reason I asked the question is that we did a program on this a few nights ago, and we had Indigenous leaders on the program, and they did acknowledge that, of course, they have closed off their communities to outsiders in order to keep COVID-19 at bay, which may have played some part of a role in all of this. But they added that, yeah, if anybody wants to say that that's the reason, that's really just making an excuse. That's not the reason. There's other reasons as well. Is that fair for them to make that point?
Well, I don't deny that there was a number of challenges in the remaining advisories and including those that are on short-term advisories, which can't be neglected in this discussion, because some of the persistent investments that we need to keep making is to prevent those short-term water advisories from becoming long-term, which they do after a year without being addressed. Part of this, and this is perhaps what they are alluding to, is that requirement from the federal government to make more long-term investments to ensure that there's water continuity in their communities that have been in a precarious position, in some cases for a quarter of a century. And so I take that criticism, and it is one, when you look at what we think will be the 12 or so communities representing about 21 advisories as of spring 2021 that will be remaining, you can roughly break them down, and it's a difficult breakdown to do. You can break them down into about 6 or 7 communities that were, yes, affected by COVID, and we're going to be with them in the long term. And then about a half dozen more that had other concerns. For example, a new build, and I'll take the example of Shoal Lake 40, with respect to which we had to build a whole new road going in, and everyone that knows the story about Shoal Lake 40 knows all the complexities that have been associated with that. And that was the preference expressed by the community, and we're working hand in hand with them. And that will indeed take a long-term approach. And I know a lot of your listeners are saying, well, when's that next deadline? When's that next deadline? And I think the effort that I've tried to be with my ministry is to be as open and frank with Canadians as possible. And the position I want to be in about spring 2021 is to be able to identify exactly the deadlines associated with the remaining communities. And now, obviously, there's a confidentiality of community membership of the leadership demands of us. But those communities that want to be open and transparent of it, we will be more than glad to facilitate that so that every Canadian knows what that deadline is and when they can expect clean water to be in those communities.
And in fairness, the people I talk to about you say, you know, he's a good guy, his heart's in the right place, he understands the problem, he really does want to make good on this. Having said that, you know, we do have a First Nation in the northwestern part of this province, Neskangtaga, which, you know, no one under the age of 25 has been able to drink clean water there. This is the longest boil water advisory in the entire country. And one does wonder how, in a developed country like ours, no government over the last 25 years has been able to figure this out. How is that possible?
It's entirely unacceptable, Steve. We're talking about a quarter of a century. If any Canadian can look at that situation and think profoundly about it, I would welcome them to do that. What I have been asked by the Prime Minister to do, and I, as a human, I'm more than glad to do my absolute best in ensuring that Skandiga gets clean water, is to fix that problem. There's a community that's not so far away from them called Lac Seul that with respect to which we lifted in earlier on in the year, but they had been in a situation for about 17 years on a long-term water advisories. These exist in that area of Northern Ontario, which is it has its challenges. But as you said, when I spoke to the room in Lac Seul, there was anyone who was adolescent age had never had clean water, and one of the older people I sat beside remarked that this was the first time that she would be able to shower and not itch afterwards. And that is happening in a country like Canada. It's something that this government has worked really hard. You mentioned $2 billion, and with the $1.5 billion that we've invested, we are working exceedingly hard to fix that. With respect to Neskangtaga, who has been in a situation even longer than Lac Seul, so 25 years, we're cautiously optimistic that the community that is currently in Thunder Bay will be repatriated before Christmas. With that plant, the new system up and running and is currently being tested in days 6 or 7 of a testing cycle that lasts about 14 days, and that they will have clean water in very short order. I would also add this, you know, the communities do lift these long-term water advisories, and sometimes when there is clean water, they want to take their time to make sure everything's right and to make sure that they have the support of the federal government. For example, in sensitizing the community that is still very fearful of even a clean water system. And as they are sheltering in Thunder Bay, a lot of them still prefer to use bottled water because of that hesitancy. It's a very real lived experience that they have. It is one with which we have to take our time to ensure we partner with that community so that we can gradually encourage them to use that water that is safe, but with respect to which they have a lot of hesitancy. And that's something that it's a nuance that we need to appreciate, because it is certainly something as a minister I didn't appreciate going in. I thought you could just lift these things and move on, and that is certainly not the case. We need to continually be in partnership with those communities. And the chief of Neskangtaga, a very forceful advocate for his people, keeps saying that, and I certainly respect his voice when it comes to water.
Well, tell us, I think you have to explain to us how it's possible that in 25 years this problem hasn't been solved. So what is it that Canadians don't appreciate about how difficult it is to solve this issue?
Well, and sometimes certainly, Steve, it's a function of remoteness. It's a function of distance. It's a function of the particular geological conditions of the community. That doesn't explain everything. A lot of it is just the function of a system that has been inherently discriminatory towards Indigenous peoples. You look at a situation, for example, that is still unresolved in many respects in Six Nations, which sits beside Brantford and Toronto. There's no reason why there shouldn't be clean water going into households, and yet that is still the case today.
But why is that the case?
Well, a function of systemic undercapitalization of First Nations on reserves in particular. Successive governments not appreciating the degree and scope of the problem. It's coupled with a more massive undercapitalization in infrastructure generally.
Do First Nations themselves not have the skills to know how to maintain and operate these plants?
They absolutely do, and that is a huge part of the puzzle going forward, ensuring that training is there in the community, that the capacity and all the brilliance that exists within that community gets the training with respect to state-of-the-art facilities. We know that water standards, particularly in Ontario, are very high. So ensuring they have the supports and the financial backing of the government of Canada. Sometimes it's a question of the Canada getting the resources and then getting out of the way. But that is a very important part of the puzzle because you want to ensure that continuity within plants. But you asked me about an explanation of why that is the case. I don't think I can offer a proper explanation to Canadians as to why that's been the case for a community that has been in a long-term water advisory for 25 years. What I can say to Canadians is that for the last 5 years, this government has made successive investments, massive investments into fixing this problem that every Canadian wants to see fixed and water in the communities, and will continue to do so, more so after spring 2021, so that we ensure that communities don't fall back into long-term and then rather short-term and then long-term water advisories, as should not happen to any Canadian or Indigenous person.
Sure. Forgive me, Minister, we're down to our last minute here, but I'll give you an explanation that was offered by one of our guests the other night, and you can comment on it. His explanation was, it didn't matter what government was in power over the last 25 years, none of them gave enough of a damn or put a high enough priority on getting this problem solved, and that's why 25 years later, it persists. Is that a fair observation?
I think it's important for viewers to be left with those thoughts and to reflect on them. I do know the now close to $4 billion this community has invested into it. It's come under the leadership of Justin Trudeau. There's a heck of a lot of work to be done. Certainly getting into power, we didn't perhaps appreciate the full scope of the undercapitalization that occurred. It's something that we continually struggle with, but we can only fix it with in partnership with Indigenous communities. But I will let those words speak for themselves.
Minister, we understand what your schedule is like these days, so we're really grateful you spared some time for our viewers here on TVO tonight. That's Marc Miller, the Federal Minister of Indigenous Services, coming to us from the nation's capital. Thank you, Minister.
Thank you, Steve.
COVID-19 has exposed many challenges for people who rely on regular medical care and ongoing support. For families with what are known as medically fragile children, that's been tough for both patients and caregivers. Mary Baxter covers the southwestern part of the province for Ontario Hubs, and she joins us now from London. Welcome to the show.
Hi, Diane. It's good to be here.
Now, before we start, let's get an idea of exactly what type of care these children require. When is a child medically fragile? A medically fragile child has one or more chronic and significant health conditions that require 24-hour care. That care usually involves family members and daily visits from a healthcare professional, such as a nurse or a personal support worker. Often these children are unable to care for themselves and need help with basic activities such as bathing and feeding. Some require special equipment, such as a ventilator or feeding tube, to stay alive. Caring for a medically fragile child is physically and emotionally demanding, requiring continuous coordination among educators, medical staff, and families. In 2019, the province provided special respite funding to 2,800 families with children who are medically fragile or technologically dependent. So now that we know the basics, Mary, you spoke to one family who had their child services interrupted by the pandemic. Tell us about that.
Landon Snyder is 12 years old. He lives in London with his mom and his sister. Landon has a number of challenges. He's developmentally delayed. He has a chronic lung disease, and he also has a seizure disorder. So when the pandemic first started, Landon actually had a lot of care because his family was going through many different upheavals at the same time. His mom has had kidney disease and had an operation, a transplant in July, and then his stepdad actually died in June. So suddenly, though, in June, Landon was sent home. Now, he came home with some supports as well, about 30 hours a week of 30 hours a week of supports. And then his mom kind of used her money to be able to bump that up to about 40 hours a week, and also some government funding as well. But she's in no condition to look after Landon even now, because she's still recuperating from her operation. She can't lift him, for instance, so she can't do a lot of the physical care that he needs. And she's getting increasingly desperate. She can't send him to school because he's too susceptible to the virus, to its worst effects, as is she. So they've been there in their small condominium for months on end now, with not enough help.
Now, for your latest for TVA.org, you spoke to a number of families and service providers about this service. Now, what are the main challenges when these services are not available? You alluded to that with the first story, but what did the other families and service centers have to say?
Parents are burning out. They're looking after their kids 24 hours. One family I spoke to, also in London, their daughter had a heart condition that she had to have an operation. And similar to Landon's story, she had support initially in the pandemic. But then the family, as she started to recover and she got back to her usual routine, she still had support, but the family had decided to tell the personal support workers that they couldn't come anymore because they were too afraid that their daughter might catch the virus. They also have another family who's susceptible. So all of a sudden, they were doing 24-hour care, where throughout all of their daughter's life, they've had help. She needs to be fed during the night. She needs someone to monitor her. Usually there was someone in looking after that. They no longer have that anymore. Clinics, medical clinics that she needs to go to, they're closed.
I'm curious how funding allocations have either helped or hindered families in this.
Well, some families tell me that they can't spend enough of the government money that they receive because they can't hire in help because they're too concerned about catching the virus. Other families, such as Landon's families, find that they're spending all sorts of money because they can't send their kids to school. So Landon's mom is worried that at the end of this year, she's not going to have enough money to get her through until the next government funding comes through, which is in late March, beginning of April.
As you mentioned, these respite centers and families rely on government funding. What does the government have to say about it?
Well, a lot of the funding for the kids comes through the Ministry of Children, Community and Social Services, and that ministry says that they have been stepping up in many different ways. First off, they can't comment on individual cases, but they do reassure parents that funding that is allocated in 1 year isn't based on what their funding might be in a previous year. So that might be of some help to parents. They've also been a bit more lenient on who people can hire in to help with their kids. So, for instance, family members or a neighbor could come in and help, which is something that was never before. So there have been some initiatives that they've introduced.
I imagine you've had some fairly emotional phone calls putting this story together. I am curious, is there anyone advocating for these children, communities, and families?
Well, they would fall under the larger umbrella of advocates for people who live with disabilities. But, a lot of these parents are so busy looking after their children. It's so very hard for them to organize. There has been some organization, for instance, here in London, parents got together to coordinate developing a respite facility quite a few years ago now. NDP critic of community and social services is Lisa Gretzky, and she tells me that what's really needed is for the province to say, okay, these services are essential for parents, especially respite care, which right now isn't considered essential, and then put the money behind it. And then also, as more generally, with the challenges that we're dealing with home and community care services, more needs to be done to support PSWs, giving them better wages and more job security.
Now, Mary, a lot of these families have been facing these restrictions early on in the pandemic. We're talking March and April. But how are these families getting by, and are there any solutions?
Some of these families, if they're able, are sending their kids back to school. And I had the chance to visit Clark Road Secondary School's developmental center here in London, and to see the variety of programs they offer. But even there's challenges. They have to cut back because of safety precautions because of COVID-19. So there's a warm water pool that they have, and where they conduct physiotherapy for a lot of these kids, but they're not able to operate that, and they've even had to turn the room over to sanitize a lot of the kids' equipment.
Mary Baxter, I want to thank you so much. Again, another very important story. That's Mary Baxter, Ontario Hub journalist covering southwestern Ontario. Thank you.
Thanks, JN.
That is the agenda for Friday, December 11th, 2020. Next week, we will celebrate Beethoven, Winnie the Pooh, and friendship in this era of pandemic. I'm J.N. Jagannathan. Thanks for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve, we'll see you again on Monday.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. And by viewers like you. Thank you.